there's a few things like I feel like, we don't see God and we don't see, but the majority of well, I should say the majority of the world, no, not really. The Christians in here, which we're hoping there's more eventually, like we can get more Christians and help people believe this as well. But there's a lot of things that are in the world that we don't know how it happens. Can't see it, and it's working. And I think that's a lot of times people are more closed minded. If they don't see it, I can't see it. I can't believe it. Even me, when I said, just have medicine on it, well, then it's not going to work. Like that's your first thought, but it's opening your mind to the new things and to the things that we cannot see that are working and that can work.
Yeah, smell works.
For sure.
Like have you ever smelled a smell and all of a sudden your memory floods and you're remembering your grandma, you know, and whatever, or you hear a song and you're remembering your puppy love from high school. Well, I don't think I still love him. Why does that feel like that? It's a memory. It's just the hypothalamus was triggered through that song, and then it began to play the memories in your body, and then your body responds biomagnetically, chemically.
So tell me about dementia and Alzheimer's. This is something you and I haven't even talked about yet, but it's talking about the brain, talking about plasticity in the brain. I know, and the inflammation is huge, and that's kind of where the plaques start to form in our frontal lobe or in the brain, where we're starting to get these people that are getting dementia and Alzheimer's. I'm seeing patients younger and younger that are getting the same thing, which is so sad. And they say there's no cure. They say there's just medication to prolong the inevitable. What are you seeing, if anything, that some of this technology can work? Can we get that? If they're more plasticity, will it build less plaque?
So I don't know the answer directly to that question, but I will tell you what I do know about neuroplasticity and brain health. Brains can actually, they can't heal what's been dead or damaged, like through trauma or whatever, but they can create new pathways.
Yes.
And you can increase blood flow. So when I have a family member that comes to me and they're struggling with someone in their family that has, cognitive decline, let's call it that.
Loss,
so if you got cognitive decline of any kind, what do we do? Number one, you need movement, because you got to have blood flow. And if you don't move, you're not going to get blood flow to the brain the way that you need it to be. You need oxygen. So just breath therapy. People don't breathe deep. They don't use their diaphragm to breathe. So sometimes we do neuroplasticity, neurofeedback with like muscle and strength, and the diaphragm is a muscle, and they'll go, oh my gosh, I'm breathing deep. And they don't even realize that it's a muscle response, right? Yeah. So you stand up straighter and you start breathing with your diaphragm, and like a singer would or whatever. So when the brain learns new information, you're not going to recover that old pathway that is dead, but you can build a new pathway, right? And so the more new pathways we build, the more neurotransmitters we have, the healthier our bowel is. And you heard me say this. I won't say the bad word family friendly. But you've heard the thing, blank for brains or crap for brains or poop for brains. The bad words what we hear in the world, but.
And it's a
true thing because whatever your bowels, your compost bin, and you're the tree, right? Okay. So the more healthy your compost bin, the more healthy the canopy is. And the canopy is this neural network in your brain. And it looks like a tree. It's even called a limbic system. A limb, L-I-M-B. The limb is where the fruit is, and you have these neurons on your little branches in your brain, and that's all your aha moments. So just like when you have a garden, you're like, oh, the fruit's coming, but when you see it, you just get so excited, you know? So it's the same way that you have to look at it like as an overall approach. And what we offer in neurofeedback therapy is not a one and done. It's a part of the process. It's just a part of, I work my body out to keep my body healthy, to keep my muscles there. If I don't have that, then I have a 40% greater chance of having a chronic disease, right? So that's why we want to keep our muscles strong. And when your muscles are strong, even while you're sleeping, it's helping your brain to clean itself every night and do the things it's supposed to do. You need to get into REM sleep, all those things. So it's really more like a lifestyle approach. And we're now finding out that we can affordably incorporate neurofeedback. Like what? It cost me $40,000 to be a therapist and have all the equipment.
Right.
So of course it was expensive to offer. And I did that in a very short period of time because time was of the essence. My son was dying.
Yeah.
Right. And so while I was studying and going to school, I paid for his neurotherapy. But once I was done with school, I became his therapist. Right. And so now we can make this affordable and like you could just put it in your purse.
Right. It's so
Or
awesome.
put it in your
But if you
pocket.
think about too, like medication that you're taking, our medicine's not cheap. Of
Mm-mm.
course, they want to keep us on medication though. So if we go down that rabbit hole, it's going to be a bad
Right.
one. But
Yeah, and
you know, I
liver
mean,
and kidney
all the
function that's
things,
compromised as a result, and cognitive function. So
all
there are
because of this
certain
medication.
certain medications, if you stay on them longer than the temporary time you're supposed to, if they become a lifestyle,
Right.
your cognitive decline increases by something like 80% with some of
I
those
can believe
drugs.
it for sure.
So you're just dementia and Alzheimer's waiting to happen.
Yep. And then this is going to shut down. That's going to shut down. And it's just this roller, this big snowball of effects to your body to just pretty much kill you sometimes. I
That's
feel
right.
like, you know, my dad's a pharmacist, so I shouldn't talk bad about medicine, but at the same time, it's not the end all. It's not the way it was created to
Well,
be. It's created to help in a short term
right.
and then be off of it and be healthy. And right now, it's not been being given out that way. I don't think. I
Correct.
feel like in our medical society right now, we all kind of talk about it. It's gotten to be very difficult for somebody to just to see a doctor and them not give you a prescription.
Right.
And that I don't want to sound. I love my doctors. Doctors are smart people, but they're overworked and they're in a system that's failing.
That was what I
system
wanted
is
to point
failing.
out was the system is the problem.
It's not the doctor.
It's not the doctor.
No,
I have a lot of
no.
doctor friends, and I'm so grateful for the doctors. And I'm grateful for medication when it's appropriate.
Absolutely.
So
Yes,
one of the
yes, we
things
need
I
it.
teach people is be your own advocate. And when you do get a prescription, you ask your doctor, hold up a second. Will I live without this? Can I recover? Will this make me well? See, a cast don't make my leg heal.
Right.
A cast holds my leg in place
Correct.
while it heals. Most medicine does not heal you. It only mitigates a symptom while your body heals itself.
Correct.
However, now you've added, in some cases, not all, but in some cases, you've added an added layer of filtration, and you compromise the body because it has toxins it's got to get rid of. So have a good relationship with your medical doctor, ask great questions, and be a fantastic advocate for yourself. And if you don't know how, hire somebody to go with you and be your advocate
Right.
until you can be your own advocate.
Yep. And when somebody's in the hospital, I usually tell them that please bring somebody with you, because if you're sick, hurting, in pain, somebody else has got to ask those questions and has to know that, not just to let them just give you whatever medication's out there, because that's, you know, sometimes that's all they know. It's this one road, and there's other roads there, but they're not going to, and they don't have time to learn. That's with the peptide, same thing. Most medical doctors, when my patient says, well, I'll go talk to my doctor when I'm trying to get them off of all this gook, you know, that's just stopping up all their system. I'll talk to my doctor, and I'm like, you can, but they don't know, and it's not their fault. They don't want to learn something else. They've got so much in their brain.
Well, and
that
they have
need
to
deal
follow
with.
a protocol
And they're following their hospital protocol, doctor protocol, whatever it is.
Yes. So they've got their malpractice insurance, right?
Yeah.
And your
Which is not
malpractice
cheap.
insurance, you're out of business if you don't have it.
Correct.
That's number one.
You have
So
that.
if in the malpractice regulatory guidelines, you must follow this system.
Right.
If you don't follow that system, your malpractice insurance don't cover you.
Correct.
So, and how do I know that? My personal doctor told me. I said, Doc, I'm at 1% chance of heart disease. Why did you give me a prescription for Lipitor? He's like, well, Angela, I have to or you could sue me. I'm like, wait. You're not giving me Lipitor because I need it. You're giving me Lipitor because I'm at 1% risk of having heart disease?
If you get heart disease and you come back and say, you didn't give me, then they're liable.
That's exactly what he told me. And I said, but Doc, if you put that in my chart and I'm ever asked on an application, have you denied or refused treatment, I'm going to have to say yes. And I'm not going to lie on my application. So do me a favor. How about you tear this prescription up and you send me a referral to a cardiologist?